it's obviously been a difficult time for everybody in New Jersey, particularly urban areas, and then particularly our most vulnerable in our community. We take into consideration all aspects of Jersey City's community that is hurting in every decision that we make, but the vulnerable need the most consideration and special attention. One of the challenges that we've had was with regard to our homeless population here in Jersey City, and we're taking special consideration in order to make sure that they have additional resources and access to a healthier environment. I want to say special thank you to the County Executive, Tom DeGise, for their partnership on this front. We're working with 3 hotels to provide housing for our homeless population. We're expanding a successful public shower program to promote cleanliness. And as part of that, we're also distributing packs that include sanitary kits, and we'll show you shortly, and MREs, meals ready to eat, for a 4-day period in order to promote people returning back to the showers and also for additional counseling. I'd like to invite up Stacy Flanagan, our Director of Health and Human Services, to talk a little bit more about the program and our outreach to the dozens of homeless people and the most vulnerable community here in Jersey City. Stacy.
Good morning. So we're standing here in front of a really exciting project we started in November after some conversation with people in the community and figuring out how we can really start moving the meter and helping people in the community figure out how we can provide them services that they're not getting every day on the street. And so since November, we have helped about a good 50 different individuals. We've provided over 200 showers, and this week, because we are really concerned, we're adding to our bag of items that we're handing out additional meals ready to eat. We are really excited that we have a team of people here that are here now Monday through Friday. And when we started this program, it was just Monday, Wednesdays, and Fridays. And we saw that there was an increased need, and we want to make sure that we're here to meet it. In addition to that, there's other programs that we're working on with the county to continue to support some of the individuals that are currently in our hospitals that need a place to stay and are in the middle of feeling pretty ill due to this COVID crisis. So I'm going to introduce Doris Toon. She is the Director of Health and Human Services for the county, so for the entire county, and she's going to tell you a little bit about the work that we're doing with the warming centers.
Thank you, Stacy. As Stacy indicated, the county is working in partnership with the City of Jersey City and, quite frankly, all municipalities in Hudson County. The county contracts with a nonprofit agency that runs a warming center for the homeless individuals. This center is typically open from November 15th until the end of March. However, due to the corona crisis, the county is extending the opening of that, or the services offered at that center, until the end of April at this point. So in addition to that, we are expanding the space that we're using at that particular center so that we can allow for greater social distancing for the individuals who are being serviced at that facility. We're doing everything that we possibly can to make sure that we can keep the homeless individuals in Hudson County safe and to make sure that they're receiving critical services that they need. In addition to what we're doing at the warming center, the county is also, as the mayor mentioned, we're also working with some hotel owner to open up some hotel rooms for individuals who are homeless. And I'm going to ask Frank Mazza to come up and talk about that.
Good morning. So when it comes to our shelter system and our homeless population, Hudson County and Jersey City do have facilities. But what we do know is that keeping space, social distancing, is what will help keep our population healthy. We also know that people who are over 60 with underlying health issues are most at risk. So as a result of the volume and the space that we have in our current shelter system, and there are open spaces where people are living in close quarters, we're looking to sort of thin out the population. What we've done is we've enlisted the assistance of a motel owner. We have access to 3 motels. And starting last week, we started moving our population of 60 and over out of our shelter system and into private rooms in these motels where they can quarantine themselves. I also run the Department of Family Services, which is welfare. So we're providing access to health insurance, cash benefits, food stamps, all online, and this population doesn't have to come into our building, and they can handle all matters over the telephone at the motel.
Okay, before we open up for questions, let me show you really quickly what we're doing here. So when you come for a shower or to one of our warming centers, you get a sanitary kit. This includes everything from toilet paper to toothpaste to wipes to hand sanitizer to soap and to disposable towels. You get meals for 4 days. And the reason we want 4 days, unless you are COVID positive, then we're going to give you meals for 14 days because we want you to self-quarantine. But the goal of this is to get more resources to our homeless population, the most vulnerable, make sure they're not on the streets, make sure they're not congregating in close quarters, and the hope is that we could promote social distancing amongst this community as well.